Welcome to Reviewing Theoretical Concepts, brought to you by Naomi, the beauty nurse. Are you ready to embark on your journey to becoming a certified nursing assistant? Today, we're diving into the essential elements of the CNA exam. When pral, pasta sa. I will pass this test. Greetings, aspiring CNAs. Today, we embark on a journey to deepen our understanding of crucial theoretical concepts pivotal for success on your CNA exam. Let's begin with the cornerstone of healthcare, infection control. This entails mastering techniques to prevent the spread of infections within healthcare settings. From proper hand washing procedures to the correct utilization of personal protective equipment, we'll explore strategies aimed at safeguarding both patients and caregivers. Infection control is crucial for certified nursing assistants, CNAs, to ensure the safety and well-being of both themselves and the individuals they care for. Here are some key practices for CNAs to follow. Hand hygiene. CNAs should frequently wash their hands with soap and water for at least 20 seconds, especially before and after direct contact with residents, after handling bodily fluids, and after touching surfaces or objects in the resident's environment. Personal protective equipment, PPE. CNAs should use appropriate PPE such as gloves, masks, gowns, and eye protection when providing care, particularly when there is a risk of exposure to bodily fluids or infectious agents. Respiratory, hygiene/cough etiquette. Encourage residents to cover their mouth and nose with a tissue or lower our elbow when coughing or sneezing. Provide tissues and hand sanitizer in resident rooms and common areas. Environmental cleaning. CNAs should regularly clean and disinfect frequently touched surfaces and equipment using appropriate disinfectants. This includes bedside tables, doorknobs, light switches, and medical equipment. Safe handling of linens and waste. Properly handle and dispose of soiled linens, clothing, and waste materials according to facility guidelines. Use appropriate precautions to prevent the spread of infectious agents. Isolation precautions. Follow isolation precautions as directed by healthcare facility policies and procedures when caring for residents with known or suspected infections. This may include wearing additional PPE and implementing measures to prevent the spread of infection to other residents. Education and communication. Stay informed about infection control practices and updates through ongoing education and training. Communicate effectively with residents, families, and other healthcare team members about infection prevention measures and any concerns or changes in resident health status. Vaccination. Stay up to date on vaccinations, including annual influenza vaccination to reduce the risk of contracting and spreading vaccine-preventable diseases. Proper respiratory technique. Ensure proper technique when assisting residents with respiratory care, such as using suctioning equipment or assisting with respiratory treatments, to minimize the risk of infection transmission. Self-monitoring and reporting. CNAs should monitor their own health for symptoms of infection and report any signs of illness to their supervisor. They should also report any concerns about resident health or infection control practices to appropriate personnel. By adhering to these infection control practices, CNAs can help maintain a safe and healthy environment for themselves and the residents they care for. Now, let's venture into the intricate realm of anatomy and physiology. Here, we unravel the complexities of the human body, from its organ systems to cellular structures. Understanding how these systems interact and function is fundamental for providing competent care to patients. Skeletal system. The skeletal system provides structure and support to the body. It consists of bones, cartilage, ligaments, and tendons. Understanding the skeletal system is crucial for recognizing signs of fractures, understanding range of motion limitations, and assisting with activities of daily living. Muscular system. Muscles are responsible for movement and providing stability to the body. There are 3 types of muscles: skeletal, voluntary; smooth, involuntary; and cardiac, involuntary. CNAs need to understand muscle function to assist patients with mobility, positioning, and exercises. Cardiovascular system. The cardiovascular system comprises the heart and blood vessels. Its primary function is to circulate blood throughout the body, delivering oxygen and nutrients while removing waste products. CNAs should be familiar with vital signs such as blood pressure, pulse rate, and respiratory rate, as well as signs of cardiovascular problems like chest pain or shortness of breath. Respiratory system. The respiratory system includes the lungs and airways and is responsible for exchanging oxygen and carbon dioxide between the body and the environment. CNAs need to monitor respiratory status, assist with breathing exercises, and recognize signs of respiratory distress. Digestive system. The digestive system processes food and absorbs nutrients while eliminating waste. CNAs should understand dietary needs, assist with feeding, and recognize signs of gastrointestinal issues such as nausea, vomiting, or abdominal pain. Urinary system. The urinary system removes waste products from the blood and regulates fluid and electrolyte balance. CNAs should monitor urine output, assist with toileting, and recognize signs of urinary tract infections or kidney problems. Nervous system. The nervous system controls bodily functions and processes sensory information. CNAs should understand basic neuroanatomy, recognize signs of neurological impairment or changes in mental status, and assist with activities to maintain cognitive function. Integumentary system. The integumentary system includes the skin, hair, and nails and serves as a protective barrier against pathogens and environmental hazards. CNAs should assess skin integrity, perform basic wound care, and prevent pressure injuries. Endocrine system. The endocrine system consists of glands that produce hormones regulating various bodily functions. CNAs should recognize signs of hormonal imbalances and assist with medications or treatments related to endocrine disorders. Reproductive system. The reproductive system is responsible for producing and delivering gametes, sperm and egg, and supporting the development of offspring. While CNAs may not directly provide care related to reproduction, they should respect patient privacy and dignity in all aspects of care. Understanding the interplay between these systems and how they function together is essential for providing holistic care to patients. Additionally, maintaining empathy, communication skills, and cultural sensitivity enhances the quality of care provided by CNAs. Next, we decode the language of medicine through medical terminology. This linguistic toolkit enables effective communication and documentation in healthcare settings. By dissecting common medical terms and understanding their prefixes, suffixes, and root words, you'll gain fluency in the language of healthcare. We will have another video that outlines important medical terms. Lastly, we confront the ethical dilemmas inherent in healthcare practice. Upholding ethical standards is integral to the CNA role, encompassing principles such as patient confidentiality, informed consent, and maintaining professional boundaries. We'll navigate through these ethical complexities to ensure you're well prepared to navigate them with integrity and compassion. By comprehensively grasping these theoretical foundations, you'll not only excel on the written portion of the CNA exam, but also lay a solid groundwork for your future practice as a compassionate and competent caregiver. Remember, knowledge is power, so let's delve into these concepts with curiosity and determination. By taking the time to connect with your patient and address their concerns, you can make a meaningful difference in their care experience. And there you have it, 3 patient care scenarios to help you prepare for your CNA test. Remember, practice makes perfect. Keep honing your skills, stay confident, and you'll be ready to ace that exam. Thanks for watching, and until next time, happy studying! Thank you for joining us for this insightful exploration of CNA exam content. If you found this video helpful and want to continue learning about how to become a certified nursing assistant, be sure to subscribe to our channel. Stay tuned for more episodes in this series where we'll delve deeper into the skills and knowledge needed for success in the healthcare field. Until next time, happy learning.